A huge congratulations to all the PG students on taking the plunge into conservative dentistry and endodontics. You have made a fantastic choice as the specialty is all about preserving natural teeth, refining aesthetics, and enhancing function. Truly the backbone of modern dentistry. You have chosen a path that combines both art and advanced science, and I have no doubt you'll excel at every aspect from intricate restorations to mastering root canals. The road ahead may be challenging, but with your dedication and passion, you are going to shine in this exciting, evolving field. So, best of luck for the journey ahead. So, the phrase treat the patient as a whole, not as a whole. In the context of conservative dentistry and endodontics, the phrase indicates understanding how oral health impacts the patient's overall health and ensuring that treatments are personalized, taking into account their systemic conditions, psychological well being, and other individual factors rather than just focusing on the technical aspects of a single tooth or procedure. The exam paper pattern for MDS students generally follows the guidelines set by the respective university or dental council. Although there might be slight variations across different institutions, the exam structure typically includes both theory and practical components. Here is a common paper pattern for MDS Conservative Dentistry and Endodontics exams. So here we are going to discuss mainly on theory exam papers. So it includes part 1, that is part 1 you are going to complete your exams in your first year of your post graduation. So it includes your paper 1, that is your applied basic science. So this paper tests the students' understanding of basic medical sciences related to conservative dentistry and endodontics. So it has anatomy, dental anatomy and histology, physiology, oral pathology, microbiology, pharmacology, dental materials, biostatistics and research methodology. Here are some of the important statistics topics relevant to research in conservative dentistry and endodontics. You have descriptive statistics, probability theory, inferential statistics, regression analysis, survival analysis, sample size determination, hypothesis testing, confidence intervals, meta-analysis and systematic reviews, error types, sampling, health information systems, elementary statistical methods. You have parametric or non-parametric tests, and next you have research methodology that includes essential features of a protocol for research in humans, experimental and non-experimental study designs, and you have ethical considerations of research. So the paper pattern consists of 10 questions of 10 marks each, so total of 100 marks. So paper 2, that is mainly your conservative paper, which focuses on the principles, techniques and materials used in conservative dentistry. It has cavity preparation techniques, restorative materials, aesthetic dentistry, adhesion mechanisms and techniques, indirect restorations, minimal intervention dentistry. So the same exam pattern includes 2 long essay questions of 25 marks each and 5 short essays of 10 marks each. Actually, the papers depends upon the university. It is different for RGHS and deemed, but here we are mainly concerning towards the RGHS papers. And paper 3 you have endodontics that focuses mainly on root canal treatment, pulp biology and periapical tissue management. So it involves diagnosis and treatment of pulpal diseases, endodontic instruments and techniques, obturation techniques, surgical endodontics, retreatment and complications, endodontic emergencies and recent advances. So the pattern of your exam paper contains 2 long essay questions of 25 marks each and 5 short essays of 10 marks each, so total of 100 marks. So the fourth paper, that is your recent advances in conservative dentistry and endodontics. So it covers the latest developments and innovations in the field, which including digital dentistry, lasers in dentistry, new restorative materials, biomimetics and nanotechnology, regenerative endodontics, cone beam, CT or CBCT, evidence-based practice and research methodologies. So the exam pattern, it contains, you have to answer 2 out of 3 essay questions. So total of 50 into 2, that is 100 marks. For MDS students, you have to refer standard textbooks, reference books and clinical guides that cover both fundamental concepts and advanced techniques. So here's a list of essential textbooks that are widely recommended. So for MDS conservative dentistry and endodontics, we have primary references, secondary references and tertiary references. And for primary references, you can refer only the standard textbooks, and for secondary references, you have to refer only the articles from the standard journals, and tertiary references, you can refer all these manuals or the color atlas of operative and endodontics books. So coming to the primary references for your operative dentistry, mainly for operative dentistry, you have Studvents, that is Studvents Art and Science of Operative Dentistry. It is a comprehensive book covering all aspects of operative dentistry, including cavity preparation, restorative materials, aesthetics, and modern approaches to minimally invasive dentistry. And then you have fundamentals of operative dentistry. It is a contemporary approach. It offers an in-depth look at restorative techniques and concepts in operative dentistry, including case-based approaches. And then you have textbook of operative dentistry by Nisha Garg and Amit Garg, and you have textbook of operative dentistry by Vimal Sikri, and you have a modern operative dentistry. You have fundamentals of operative dentistry by Balwant Rai, and you have principles of operative dentistry, and you have many more textbooks like Ramya Raghu textbook. You have Mitra and Egde textbooks. So coming to the dental material aspect, material science, if you want to read only the material science of the material science in our specialty, you can read Phillips Science of Dental Material. It is a detailed book covering the properties and clinical applications of dental materials, which is crucial for both conservative dentistry and endodontics. And then you have Craig's Restorative Dental Materials. This book gives a scientific understanding of dental materials, including the physical, chemical, and biological properties of restorative materials. And you have Mahalakshmi, a textbook also. It has a lot of materials which is involved, that is your cements or bonding agents or your impression materials, which is very nicely explained in your Mahalakshmi textbook. And for preparation aspect, preparation like cavity preparation or tooth preparation, like class 1 to class 6 preparations for many restorative materials like amalgam, cast coat restoration or composites or GAC, you can refer your Stadvance, Mazuk or Charbonneau textbooks. And for endodontics, you have classical Grossman's endodontic practice. It is a reference in endodontics. This book covers the fundamental principles of root canal treatment, which includes diagnosis, treatment planning, and complex case management. And you have Cohen's Pathways of the Pulp, which is a highly regarded endodontic textbook focusing on clinical and scientific aspects of root canal therapy, trauma, and the latest advancements in endodontic techniques like rotary instruments and obturation methods. And then you have Ingalls Endodontics. It is a comprehensive textbook that covers both conventional and advanced endodontic techniques, diagnosis, instrumentation, and treatment planning. And then you have endodontics, that is principles and practice textbook. You have endodontic microsurgery. It is a specialized text focusing on endodontic surgery with emphasis on microsurgical techniques and its instrumentation and advancements in the field. And you have various other additional reference books and clinical guides that you can refer. You have textbook of endodontology, you have aesthetic dentistry. It's a clinical approach to techniques and materials. In this textbook it is very important for understanding the aesthetic aspect of conservative dentistry, including smile design, veneers, and adhesive techniques. And you have clinical problem solving in dentistry. It's a practical guide for MDS students with clinical based problem solving approaches, which is highly useful for viva and practical exams. And then you have lasers in dentistry, which focuses mainly on the use of lasers in conservative dentistry and endodontics, and it's an emerging area in modern practice, and also it is a minimally invasive instruments which is elaborated in the modern practice. And the next will be your secondary references. So secondary references will be your articles, okay. Primary references will be your textbooks, okay, only the standard textbooks. As a postgraduate student, you have to refer only the standard textbooks and the articles which are published in the PubMed International Index journals, okay. So there are few index journals, that is Journal of Conservative Dentistry and Endodontics, Journal of Conservative Dentistry, Journal of Operative Dentistry and Endodontics, Operative Dentistry Journal, Dental Materials, Journal of Endodontics International, Endodontic Journal, Australian Endodontic Journal, European Endodontic Journal, Endodontology, Dental Traumatology, Caries Research, and you have DCNA articles also. And next will be your tertiary references. So tertiary references, like these are not primary references. You can refer these things for your knowledge purpose, okay. But your Anderson textbook of traumatic injuries of the teeth, it is very helpful in understanding the concepts of traumatic injuries to the teeth, okay. And next you can refer your Pickett's Manual of Operative Dentistry. You have Gopi Krishna manual in your operative dentistry, and you have Color Atlas of endodontics, and many more. So by thoroughly studying these textbooks and staying updated with the latest literature and advancements, you will have a strong foundation to excel in your MDS. So in this video, we discussed about standard references for MDS conservative students. So in the next video, I'll be discussing on how to attempt MDS theory paper in detail. Okay, thank you.